My name is Creighton Kaiser, and I'm the pharmacy director for a health system in Indiana. And I have been with this health system for about 12 years, and I've been in pharmacy leadership for close to 10 years. I oversee a lot of clean rooms at multiple different hospitals, and part of that, you have to do viable air and viable surface sampling. The intervals kind of changed a little bit, but it's every 6 months on the air sampling and monthly now on the surface sampling. And one of our sites specifically, we kept growing really low levels of certain organisms in our clean room or in our ante room. So we wouldn't grow them in the hoods, which is great, but they were still in the air in the clean room and in the ante room, which obviously poses a risk if you have that stuff floating around. And so we were looking at options to kind of see what could help us beyond just our policies and procedures we were already following and cleaning and different things like that. What else was out there that might be able to assist us with this problem? Because if you fail these testings, there's a lot of retesting that goes on, and it costs a lot of money and time and action planning. And not only do you want to avoid any contamination from a patient safety standpoint, but also it is a very big headache and a lot of hoops to jump through if you do have a viable surface or air failure in a space. So we were looking for a solution to remediate that issue and just make things smoother and ultimately provide higher quality product for our patients. Many of the solutions or options out there we were looking at, the main hurdles we were facing were that the space has to be vacant. The product runs or, does what it does. Can't have staff in there actively working. And, these clean rooms are in hospitals that have real life patients and have emergency departments, and you don't know what might walk through the door in 5 minutes or 10 minutes or 30 minutes. So you can't just shut down that space and not be able to provide medications for your patients. And that was a big hurdle for us. Also, some of the solutions didn't have great data necessarily on some of the organisms we were specifically interested in and what we felt like could cause a problem for us at some point, or are known, problems in the hospital arena. They just didn't have great data backing up, what their kill rates or times or things like that were specific for those organisms. And once we learned about Synexus, it really kind of solved all those problems. The ability to run it 24/7, 365 was huge, and to be able to have it in occupied spaces where the staff can continue working. We don't have to shut that clean room down and let it run or anything like that, like some of the competitors we were looking at. That was a huge selling point for us, and definitely one of the things that ultimately led us to go with Synexus. And then additionally, they had good data for many of the organisms we were concerned about, and rates like 99.98 and 99.99% killed in 1 hour or 2 hours or etc. So just having it be able to run all the time in the background, feel like it's working all the time in the background, were ultimately some of the things that led us to choose the DHP from Synexus over some of the competitors on the market. From the staff standpoint, they like it because we're not having to action plan and kind of retrain and go through things as much, because we really do pass all our sampling. We've had DHP from Synexus in our clean rooms for a couple years now, and we have had 0 failures on surface or air sampling in that time frame. And to be honest, almost every time we get tested, we have 0 CFU of anything across the board, which if you do enough testing and reporting, you're going to have these kind of onesie twosie contaminants that come up, because again, you just have people involved in the process. So there's always that small risk of contamination. And you're even permitted through 797 outside of the hood to have kind of low levels of organisms grow. You're keeping an eye on it to make sure it's not trending up, make sure you're below those thresholds, etc. But most of the time on our areas with DHP, we grow 0 CFU across the board. And I think that's partially due to our practices and procedures and our staff being trained well. But I know that DHP from Synexus also plays a role in that. So we take these viable surface sampling reports up through our environment of care committee, and they're always amazed at how, we have this area that we're mixing in. The testing happened in the middle of the day in a busy clean room, and it's 0 CFU across the board for growing anything. It really is a result, like I said before, of the DHP in the room. If you're at a pharmacy, like I explained earlier, where you're having some viable air surface failures or having issues and you're looking for solutions, 100% you should get DHP from Synexus. There's no question in my mind. It will make your life easier. It will save you money because you will not have to retest, and it will save you a lot of headache, things like that, because you don't have to action plan and figure out what's going on and all that type of stuff, because it just adds that extra layer of protection. And if you're a site that's not having failures, it just provides a peace of mind. And I do think it's safer for your patients. It just makes everything go a little smoother if you have it. So I would still highly recommend you look into it. It's very cost effective. It does not require capital at our health institution for what the installation costs were and things like that. So it's not a super expensive product, but you get fantastic results. As I said earlier, we have not failed a single viable air surface sampling test in these spaces. And that's over several years. It's not from something recent since we instilled DHP from Synexus. So if you're having problems, get it 100%. If you're not, at least look into it. I think you appreciate what it could bring to your sterile compounding area.